Simply put, over the next 2 days, this workshop seeks to generate action on the reduction of salt and sugar. The overall goal of the Ministry of Health and Wellness is to promote good health of the nation, which in turn supports productivity and development. Barbados joins the rest of the world in noting that non-communicable diseases, NCDs, are the leading causes of preventable mortality, related disability, and premature death among our population. There are 4 groups of these diseases. Cardiovascular diseases, which include, among others, hypertension, heart attack, strokes, peripheral vascular diseases, cancers, breast, prostate, colon, cervical, being the main causes of cancer in our public health setting. Chronic respiratory diseases, example asthma, and chronic obstructive pulmonary diseases, and diabetes mellitus. And these have 4 common risk factors: tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets. Continued growth and development of our nation relies on a healthy population, and therefore, there continues to be a need to apply strategies not only for dealing with the negative outputs of the NCDs, but for reducing the incidences of these conditions. NCDs make up the largest area of expenditure in the national health budget, but this cost is not only counted as monetary costs, but as costs to livelihoods and families. It is vitally important to know and to understand the hurdles we must overcome before we can solve the NCD problem. Many challenges exist against the fight against NCDs. Some cultural, some economic, some political, some because of resistance to change, and of course the advent of COVID-19. This pandemic has shown us that those with underlying health issues, including the NCDs, have a higher risk of severe COVID-19 disease and are more likely to die of COVID. The government is committed to ensuring that our healthcare system is capable of effectively treating those afflicted with NCDs. We are committed to working with partners across society. We are committed to ensuring that there are resources in place to educate, empower, support, and care for people living with NCDs and those at risk. Let us now focus on our children. By now, we are all aware that obesity in the young is a precursor for obesity and NCDs in adulthood. Childhood obesity is increasing, and small island developing states such as Barbados are particularly vulnerable to its impacts on development and our economies. While prior to the 1980s, undernourishment was a major issue in our region, the rates of pediatric obesity have been increasing. In Barbados, in 2018, 32% of our children were overweight or obese. This is contributed to by low levels of physical activity and high levels of consumption of processed foods that are high in sugar and salt, as well as fat. One of the worrying patterns that we continue to see is the shift towards foods prepared outside of the home, which are high in salt, refined sugars, cholesterol, trans fats, and saturated fats. Related to this is our concern about the marketing of calorie-dense, high sugar, high fat, high salt foods to our children. This takes place not only through various media channels using signage, characters, and symbols that appeal to children, but through sponsorship of school-related sporting activities.